wellness revolution starts now.
Welcome to the show. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy, and I am very excited to share with you a recent publication that I got in the Journal of Independent Medicine. So I want to give you a little bit of background on this and why this is important, not just for guests of Physicians Preference Pharmacy, but also for guests of the Hotze Health and Wellness Center. So we know that something that is top of mind for us here is really being able to practice medicine freely. And this is something that draws our guests to us and that we are like-minded in. And so something important about this journal is that if you've been familiar or been following for the past 5 years, the FLCCC, which was the Frontline COVID Critical Care Alliance, has recently, in the past 6 months or so, been renamed as IMA, or the Independent Medical Alliance, which the name gives you some insight about the nature of that organization. For the past 3 years, I've been attending that conference, and I was asked to co-publish some information in this journal in the first edition. So certainly that's an honor, but most importantly, what I want to do is explain to you how important having an independent medical journal is. What that means is that it's not backed by agendas. It's not paid for by big pharma. What this is this is intended to educate. At the end of the day, you have the choice of what pharmacy you go to, what physician you go to, and truthfully, it's actually your responsibility to educate yourself and make decisions that make sense for your lifestyle and yourself. So I want to share with you a story. And this is a story about these 3 case reports that we wrote in here. I co-published this with Dr. Yusuf Salibi, who is out of the Carolinas and has a holistic medical practice there. But the case that I share is about a guest of the Hotze Health and Wellness Center and Physicians Preference Pharmacy. Our journal is titled Amlexanox, a promising alternative to steroid and antihistamine dependence in patients with Mast Cell Activation Syndrome, which is MCAS, allergies, asthma, and autoimmunity. So we reported on 3 separate patients here who have had a phenomenal turnaround with Amlexanox. Amlexanox is a compound that we make at Physicians Preference Pharmacy, and it originally was on the market as an oral paste, actually, to help with ulcers inside the mouth. But with a lot of repurposed medications, we find out that they're good for other things too. And so we're focused on the repurposed uses of Amlexanox. Now, Amlexanox, we use it now as an anti-allergic and an anti-inflammatory. It is very helpful for symptoms in the respiratory tract, topical issues like eczema, for those people that have tried so many things and have not actually been able to respond well to the treatment. And this is likely or largely due to the pharmacology, so the structure of the molecule of Amlexanox, of how it works. It works a lot like a steroid without the side effects of a steroid, which is a beautiful thing. So we found that Amlexanox has a lot more broader applications. I want to share with you the case study that I wrote up here. And so this was from a young lady who's 60 years old. She's a guest of the pharmacy and Hotze Health and Wellness Center. And she presented to us with treatment refractory, which means she's tried everything else, it hasn't worked, Mast Cell Activation Syndrome, okay? So over the past 5 years, I have been absolutely overwhelmed with the amount of people calling the pharmacy saying, oh my gosh, these symptoms that you're talking about MCAS, which is Mast Cell Activation Syndrome, match everything I have, and I haven't been able to find anyone who knows what it is, anyone who knows how to treat it, or anyone who frankly believes that my symptoms are true. So if that sounds like you, I really want you to listen up because this is an incredible turnaround I'm about to share with you. So in 2023, she presents to us with treatment refractory MCAS, extensive inflammation affecting her eyes, hands, feet, and knees. She also would have a Herx reaction, which you've probably heard of that. It's a drug-related reaction, typically comes from using antibiotics, but she would respond like that when she took any medication, so highly sensitive. So she would have notable adverse reactions following doses of any medication that she took, supplements that she took, And listen to what she would experience, okay? Eye blisters, puffy eyes, swelling of the hands, intense redness and swelling in the ears, resembling a sunburn, sensitive to the skin, severe itching affecting the mouth, nose, face, torso, swollen tongue, and darkened lips. She often felt like she was having the sensation like her calves were about to pop. And due to the brain swelling, she felt like her scalp was spongy. So this is something that seriously needed to be addressed, okay? When she came to us and when I first started speaking with her, she was taking 81 different medications and supplements in combination. So I had to print that out, go through it, do a drug review, and be sure we weren't duplicating anything because no one wants to be on 81 of anything, all right? She had formal diagnoses of Lyme disease, leaky gut, inflammation, MCAS, Babesia, biofilms, candida overgrowth, so fungal overgrowth, which we treat here, and insomnia. So as if that wasn't enough, in working with her physician at Physician's Preference Pharmacy, we had recommended that she try adding in Amlexanox. The reason why is that Amlexanox is a mast cell stabilizer. And so what that means is that you've got these mast cells, which are immune cells inside of the body, in every organ, every tissue, central nervous system, and they're supposed to keep you safe. So whenever they perceive a threat, they just start spraying their contents like a skunk. So basically, everything that's inside of those mast cells get sprayed all over the body, including histamine, which causes insomnia, causes poor digestion, it causes headaches, and it causes itching that will not stop. Your body's trying to protect you, but it seems like it's working against you. So with the addition of Amlexanox, after just 60 days of being on Amlexanox, this individual who was reliant on multiple inhalers, not just a maintenance inhaler, but a rescue inhaler as well, we brought her down from 81 medications and supplements to just 17. So as a pharmacist, what we're often trying to address is something called polypharmacy. When patients are on multiple medications, multiple supplements. Listen, we get to the point eventually where we're just doing too much. We need to give the liver a break. We need to give the detoxification system a break. We need to allow the body to actually be able to sort through those things, to digest them and to metabolize them well. Otherwise, we get backed up. It can be doing more harm than good. So Amlexanox over and over again has been a fantastic tool for us and our prescribers to be able to use Amlexanox to bring it in, to add this one agent and pull patients off of many of their other medications. I've also had several physicians that prescribe with us tell us it's brought their patients' blood sugar back into check, that they've been able to lower their insulin, that it's decreased their food sensitivities, and that they've received overall improvement, not just with their skin, but with their brain fog, with their neuropathy, with their weight. And so the good news just keeps on coming. But I wanted to share this with you because it's a wonderful thing to have this publication in this first edition here. I think that we're trending in the right direction when we have journals of independent medicine that get published like this. So if you have further questions about Amlexanox, how it works, if you have any of those symptoms that are listed in there, please give us a call at the pharmacy and let us know. This is also available for free online on the IMA website. And certainly if you've got questions, please give us a call at Physician's Preference. Our phone number is 281-828-9088, and it would be our privilege to serve you. Did you know that pharmacists are considered the most accessible healthcare professionals, and yet at the same time, we are generally the most underutilized? Pharmacists are medication experts, which means that we can best advise you on the safe and appropriate use of your medications, when to take them and how to take them. We're experts in pharmacology, which means that we receive extensive training to understand the science behind how medications work within the body. We screen for any interactions which may occur between the medications you're taking, and we have an in-depth understanding of how these medications affect each system of the body. Your body is unique, which means that the type and dose of medication you take should also be unique. We want you to know that at Physician's Preference Pharmacy, we are always available to you, and we welcome your questions.
information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.